means a lot to me, knowing that it is other people like me. Because when I was a kid, I used to think I was the only one.
My name is Tawana. I am the caregiver of my son, Tyreek, who is a patient with APDS. My husband and I had been trying to get pregnant for some time. We were just so happy that we were finally parents. It was a lot of fevers. We would take them to the emergency room, and everyone would tell us there's nothing wrong. I knew something had to be wrong.
My childhood mainly consisted me being in and out the hospital, pneumonia, surgeries, ear tubes. I missed a lot of school because I was constantly sick. I really didn't get to hang out with any of my childhood friends, so whenever I did get a deep connection, I would lose it. Oh, why you can't come outside and play? You kind of laugh at that person, oh, you got the cooties. It turned a lot of friends into bullies.
We kept him in the house pretty much, just him and his father and I. We would take him to a gang room. We have our little wipes with us. We had to wipe off the little buttons and whatever. His doctor, he had referred us to the NIH clinic.
The first time I went to NIH, they drew a lot of blood for me, and they used that for testing. And they told us, well, you have APDS.
Me as a mom, I felt good that we had this diagnosis.
We didn't know what the next step was. We didn't know what to do. So we were still kind of lost.
Talking with Tyreek, he said he wanted to try the Joenja so that he can have a little bit more normal life.
In my experience on Joenja, I started feeling better. I started getting sick less.
He flourished. He was able to start living.
Now I'm able to have a job. I'm able to have friends. I'm able to just mainly be free.
We were living behind a locked door. We've unlocked that door. We've invited friends in.
Knowing that it is other people like me. We got the same story you can relate to or share your story with or hear their story.
It feels good. It feels good to have someone just like you.
You're not alone, and don't be afraid. It will get better. It's just gonna take some time.
I would just like to say, we're here. We're here.
Approved use. Joenja, leniolisib, is a prescription medicine that is used to treat activated phosphoninositide 3 kinase delta, PI3K delta syndrome, APDS, in adults and children 12 years of age and older. Important safety information. Tell your healthcare provider if you are pregnant or plan to become pregnant. Joenja may harm your unborn baby. Your healthcare provider will do a pregnancy test before you start receiving Joenja. Use effective birth control to prevent pregnancy while taking Joenja and for 1 week after you stop taking Joenja. If you plan to become pregnant, continue taking your birth control for 1 week after stopping Joenja. Talk to your doctor about what type of birth control method is right for you while taking Joenja. It is not known if Joenja passes into your breast milk. Talk to your doctor about the best way to feed your baby if you take Joenja. Tell your healthcare provider and pharmacist about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Joenja and certain other medicines may affect each other. Tell your healthcare provider if you are scheduled to receive an immunization, vaccine. Joenja may affect how well a vaccine works. Discontinue Joenja and seek immediate medical attention if you develop any signs and symptoms of serious allergic reactions, including itching, skin redness, hives, rash, difficulty breathing, or swallowing. The most common side effects of Joenja include headache, inflammation of sinuses, weight gain, and dry, itchy, and inflamed skin, eczema. These are not all the possible side effects of Joenja. Tell your healthcare provider about any side effect that bothers you or does not go away. You can also report negative side effects to the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch or Pharming Medical Affairs at 800-930-5221. For more information, please see the full prescribing information.